It has been a rough start to 2021, with health officials sounding the alarm on the worsening coronavirus pandemic. Many are warning hundreds of thousands more deaths are possible if the vaccine distribution plan does not change. So here you can see people in their cars lining up for a shot in Texas yesterday. Numerous counties there are now out of the vaccine. In Northern California, one hospital had to move fast to give out hundreds of doses that thawed out after a power failure. According to Johns Hopkins University, the U.S. has averaged more than 2,500 deaths every day over the past week. That is one American life lost every 33 seconds. And new projections suggest that we could see more than 500,000 deaths by early next month if states do not reimpose safety measures. Meanwhile, across the pond, Britain is entering a new nationwide lockdown to try and stop a fast-moving strain of the coronavirus, a new strain. So for more on this, let us bring in Dr. Dyan Hes. She is the founder of Gramercy Pediatrics. Thank you for joining us, Doctor. I just feel like that's a lot of heavy stuff for people to sort of take in. Last night, Prime Minister Boris Johnson said that this new variant was 50 to 70% more transmissible. That's at least a range coming from an authoritative figure that we haven't heard before. According to a new study, it seems as if perhaps this new strain could become more of a problem. What can you tell us?
Well, we don't know much, but what I do think from what we're seeing is it might be more transmissible, but it might not be as lethal. So it might spread very quickly and it's extremely contagious, but we're not seeing those numbers going up in the hospital, like people intubated, but it's too soon to tell. And like I think I said last week, I felt like it was already here because we're seeing these surges like California, New York, we're seeing more cases. Like in March, April, May, when it was very high, I wasn't seeing tons of cases in my office, but now we're seeing a couple a week. And I think it's here and it's spreading through families very quickly, but my patients aren't as sick. So that might be, a good thing in a way that it's not as virulent, but it's too soon to tell. We really need to do these studies. And you have to remember, a lot of people who are getting tested are getting the rapid test. And the rapid test doesn't send your nasal secretions to a lab to check that DNA. So the doctor will write it's positive, and then that rapid test goes in the garbage. So we don't really know how many of those rapid tests are the new strain.
So, Doctor, the UK, as you know, is facing some criticism over its vaccination plan. They're working to get the first dose to as many people as possible, rather than setting aside shots to ensure people will receive 2 doses. Is that something the United States should consider?
I am not a fan of this plan. So if we know anything about vaccines, they're studied in a certain way to boost the immune system's response. So if I have a patient who gets only 1 varicella shot and never followed up for their second, and I draw titers, usually they don't have enough titers to make them immune to varicella. Same for hepatitis B. So why they think that giving a half a dose of coronavirus vaccine will immunize people, and they definitely will run out for the second dose for sure. I don't think it's a good plan. Until somebody shows me the data that works, I am not a fan of that idea.
And we should point out that I think last night, perhaps the FDA kind of responded to the reports that may be something that's being considered here in this country, and they basically said similar to what you said, there's no data to indicate that could work, that they approved these vaccines based on a set dosage and a set timetable, and that is what they're sticking to. That being said, it seems like something needs to be done, though, about the schedule for vaccinating people. Take the city that you're in, Doctor. New York City used to be the pandemic. There are the pandemic epicenter. There are 8 million people in the city. Thus far, 110,000 people in the Big Apple have received their first shot, and now we're talking about the discovery of this new, more contagious variant of the virus in the state. How concerned are you about the plan that has been put in place to get people vaccinated?
Oh, there is no plan. So if there was a plan, I would be happy. I have to tell you that last night I went on Serve New York. It's for physicians to sign up to be able to give the vaccine. I've been begging to give the vaccine. I will volunteer 24/7 to give the vaccine. It took me over 1 hour to register. I had to find my DEA license expiration date, my New York State license expiration date. I mean, my friend who's an orthopedist at Mount Sinai signed up to be a volunteer to give the vaccine, but her basic life-saving license from like medical school expired, they won't let her give the vaccine. We are doctors who work every single day. They have put so many barriers in the way to distribute this vaccine. I mean, let alone the healthcare workers aren't getting it. The elderly are not getting it. It is just a debacle on every level. I am so upset about this. I am so upset. My doctors in my practice still have not gotten the vaccine. My nurses have still not gotten the vaccine. My mother has not gotten the vaccine. We want to see our moms. We want to see our families. This is just, every doctor I know is willing to work to give this vaccine. Why can they not get us there to put us in contact with that vaccine?
Dr. Hes, you will recall at the start of the pandemic, disinfectant sprays and wipes flew off the store shelves. It's been a year now. We've learned a lot more about the coronavirus and how it's transmitted. I know that it's important that we continue to wash our hands before we touch our faces and that we socially distance and wear masks, but what about scrubbing surfaces, wiping down our remote controls after we come in from outside, or our doorknobs? I mean, is that still as important as it perhaps was in the early days when we didn't know a lot about the coronavirus?
To confess, I don't think it was a huge deal from the beginning, so I never washed my groceries or cleaned my groceries. I never wiped my remote control. But that being said, like, if you work in a school, you might want to wipe that door handle because there are so much traffic going in and out of that classroom, or in a doctor's office. But at home, I think if you come home, you wash your hands. If you are a healthcare worker, if you change your clothes, I think that's enough. I don't think cleaning groceries is what is like causing or preventing the spread of COVID. It is a respiratory droplet. You need to wear a mask. You need to wash your hands. I mean, if you're on the subway, when you come off, or a bus, you should wash your hands. Common sense. I don't think, they're showing a water fountain. I don't know if I personally drink from a water fountain right now, and most of them are closed. Bring your water bottle, just hand washing and masks. I think that's enough.
All right. Dr. Dyan Hes, always great to have you, doctor. Thank you.
Take care.